Hello, let's introduce the operation of EMS Slim Sculpt Machine. EMS Slim Sculpt Machine is mainly used for muscle gain and fat reducing. But a good therapeutic effect requires the combination of balanced and healthy diet. First, let's introduce the interface. Click the screens, there will be automatic mode and manual mode. And we can look at the automatic mode firstly. Select gender, age and treated area, and then enter into the parameter adjustment interface. There are 5 modes, M1, M2, M3, M4 and M5. These 5 modes could be selected based on customer's exercise and body fat conditions. M1 is the basic training for beginners. M2 is adaptive training. M3 is primary training. M4 is advanced training. M5 is professional training. In each of these 5 modes, there are 6 frequencies cycling. And this 1 minute is for the warming up, which is included in each mode. Here is the adjustment of radio frequency intensity of each handle. Here is the adjustment of the magnetic vibration intensity of each handle. Recommend RF intensity is 20% minus 60%. We should not set it at too high intensity to avoid skin burns. Magnetic vibration intensity should be adjusted according to customer's tolerance. And the energy should be set from low to high gradually. Now, let's look at the manual mode. First, select gender, age and treated site. The difference between manual mode and automatic mode is that for manual mode, it's necessary to adjust 3 frequencies, respectively F1, F2, and F3. It's recommended that set F1 at about 50 Hz, F2 at about 5 Hz, F3 at about 150 Hz. It also should be adjusted based on client's tolerance. Recommended treatment time for each part is 30 minutes. This is for treatment time adjustment. F1 is 5 minutes, F2 is 1 minute, F3 is 5 minutes. They will work in cycle until the set treatment time finished. For example, if you do not want to use F1 for treatment, we can click here to jump to the next frequency. And here is the adjustment of RF intensity. Here is the adjustment of magnetic vibration intensity. It's recommended that energy should be adjusted from low to high gradually. Suggested RF intensity should be 20% minus 60%. And suitable treated endpoint should be warm. We should not set it at too high intensity to avoid skin burns. Magnetic vibration intensity should be adjusted based on customer's tolerance. After adjustment, click Start button for treatment. About the parameter setting, we will also offer recommended parameter table. These are the materials needed for treatment: towels, liner pen, gloves, body fat pliers, measuring tape, alcohol pad, thin bandages, rod bandages, tissue. Now, let's introduce the operation process. First, we should have the patient sign the informed consent, exclude contraindications and inform clients about post-operative precautions. Here are the contraindicated area: head, neck, chest, and heart. Do not put 2 handles opposite to each other. For example, do not do this. And do not operate directly against the bone area, such as the knee. Next, remove metal ornaments. Client should put on loose clothing, for the convenience of fat thickness and size measurement. It's necessary to mark down the measure data for comparison. Then mark out treated area, and take photos before treatment for comparison. First front side, then 45 degrees, lastly 90 degrees. Now, let's attach the bandage to fix the handle to the flat handle. We should tie bandage first and then put the handle in. If the abdomen is small, 1 handle is enough. If the abdomen is big, 2 handles should be applied. For abdomen, pay attention to avoid the ribs and ilium. After fixing the handle, we can adjust the parameters. Generally, we choose automatic mode. And then click the gender, age, treated area. We choose the pattern, adjust RF and magnetic wave intensity, and treatment time. Click Start button before starting. We can tell the client how's the feeling during treatment, and ask them to relax, and do not to be too nervous. And we should communicate with client to check if they can bear the vibration and continuous muscle contraction or not. During treatment, it's necessary to observe the skin condition every 10 minutes. Click to pause, and then remove the handle to check if there is sweat or any burns. If there is sweat, use a towel to wipe it dry. If everything is good, put the handle back and continue the treatment. It's better for the operator to wear gloves as human body is conductive, so as not to affect the transmission of current. We should communicate with clients about their feelings from time to time during treatment. Ask the patient if they can tolerate higher energy, or if they need to decrease the energy, which can be adjusted at any time during the treatment based on the client's feeling. And we must check now and then if the client feel too hot or not. If the client feel too hot, RF intensity must be decreased in time to avoid skin burns. Every 10 minutes, remember to check if there's sweat, or the skin turns too reddish. If there is sweat, wipe it dry in time as the water droplets will lead to a too high temperature. Treatment side of handles must also be kept dry, and it should be closely touched to the skin to avoid the gaps, which will cause us to incomplete circuit, resulting in skin burning. We suggest 30 minutes for one treated area in each session, not more than 1 hour. Total treatment time for multiple treated areas should not be more than 1.5 hours. When the set time is up, the machine will pause automatically. Before putting the handle back to machine, we need to clean the handle with alcohol pad, and then wipe it dry with dry tissue. And make sure the handle is dry, and free of water. Then massage the treated area for 3-5 minutes to relax the muscles. We can also do the massage with any device for muscles relaxing, such as a roller. Finally, we need to tell client about the postoperative precautions, and inform them the next treatment time. It is recommended to do the treatment 2 to 3 times a week. That is, once every 2 to 3 days. 4 to 6 sessions as a course of treatment is recommended. Now, we demo on how to put the handle on the other parts of body. Then, we demo on curved handle bandage tying method, and the placement of handles. Thin bandages for curved surface handles. With the glued side down, one end go through here first and then pass through this gap. And now we show the correct sitting posture of cushion demonstration, just the height of seat, feet open and the spine keep vertical. Let's see incorrect sitting posture of cushion demonstration. Legs spread apart. Cross legs. Legs slanted to one side, knees inward, legs putting together, feet hang up, bent down. Okay, in this video, we provide an introduction to the M-Slim Sculpt machine, including the interface, intraoperative operation, postoperative precautions and treatment courses, as well as the bandaging method and correct posture. Thank you for watching. See you next time.